Alright guys, this is Dr. Simran, and in this video we're going to talk about a very important thing, that is how to differentiate cyclosporine from tacrolimus. So basically we have two drugs here. Number one drug is cyclosporine and the another one that we have is tacrolimus. Now first thing that you should know is that both of them, they are under the category of immunosuppressant drugs or immunomodulators. So both of them are immunosuppressants, right? And both of them would be helpful in case of prevention against the organ transplant, solid organ transplant rejection prophylaxis, in fact. All right, so if a person has undergone any solid organ transplant, they could be useful. In fact, if you talk about cyclosporine, that could be useful also in case of the cases of rheumatoid arthritis and psoriasis, and it has also been approved for the cases of ALS, right? So let us discuss how they work. One thing that is common in both of them is that both of them, they are going to inhibit the activation of T cells. Inhibit the activation of T cells. Alright. And one more common thing between both of them is how they are going to inhibit the activation of T cells by the prevention of interleukin 2 transcription. Interleukin 2 transcription. So keep in your mind that these both points, they are the similarities. They are common for both of them, cyclosporine and the tacrolimus. But now the question arises, okay, what is the difference? Now remember guys, this is a keyword, so highlight it. Cyclosporine, it binds to dash. Your answer will be cyclophilin. It binds to cyclophilin. So it's easy to remember cyclosporine, cyclophilin, right? Whereas tacrolimus, it is going to bind to there is something known as FK506 binding protein. So this is FK506 binding protein, right? So number one, their binding things are different, right? Cyclosporine is binding to cyclophilin and tacrolimus is binding to the FK506 binding protein. But the common action is both of them are going to inhibit the T cell activation by preventing or inhibiting the interleukin 2 transcription. Alright. Now next difference between cyclosporine and tacrolimus. The difference is about the side effects. Now remember guys, cyclosporine is more prone to cause gingival hyperplasia, hirsutism. Gingival hyperplasia and hirsutism. If you remember guys, we read about gingival hyperplasia most commonly about the phenytoin, right? So cyclosporine is another drug that could lead to gingival hyperplasia. On the top of that, it also leads to hirsutism, right? So that means the male pattern distribution of hair in a female, that is hirsutism. And hirsutism is a very common feature in a condition, in a pathology known as PCOD, polycystic ovarian disease, if you remember that. Now talking about the tacrolimus, you will write that tacrolimus does not cause gingival hyperplasia or hirsutism. So this is the difference number 2, that tacrolimus is not going to cause gingival hyperplasia or the hirsutism. Number 3, right? Tacrolimus is more prone to cause neurotoxicity, more risk of two things associated with tacrolimus. Number 1, neurotoxicity. Number 2, it increases the risk of diabetes. Highlight this point, very important. It increases the risk of diabetes. So this is very, very important point, so highlight it. Tacrolimus increases the risk of diabetes, whereas the risk of neurotoxicity with the cyclosporine is not as high as tacrolimus, right? What are the other side effects of cyclosporine? Your answer will be hypertension, hyperlipidemia, nephrotoxicity, alright? Other side effects of tacrolimus are similar to cyclosporine. So they would be nephrotoxicity, hypertension, hyperlipidemia. But remember, gingival hyperplasia as well as the hirsutism is not seen in case of tacrolimus. Alright. So remember these points regarding the cyclosporine and tacrolimus. And if you like this video, please hit the like button and subscribe to my channel. I would be coming up with many more high yield points. So stay tuned. Bye bye.